Welcome to the MamasteFit podcast. In this episode, we're chatting with Dr. Jen Fraboni, who is known as DocJenFit on Instagram and all the different platforms. She's a physical therapist, and we're going to be talking about what is the best posture. And spoiler alert, there is no best posture. And so we're going to talk about the nuances of why it's important to be able to change positions and how this could support you during your pregnancy, in your preparation for birth, and into the postpartum. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We're glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit podcast. In this episode, we have DocJenFit here, also known as Jen Fraboni. And so I'm really excited to chat with her all about posture, mobility, and how important it is to move your body intentionally throughout your pregnancy, after birth, and really just like any time within your life. So thanks so much for being here, Jen.
Yeah, thanks for having me. I have always enjoyed following you guys and learned so much from you guys as well. So I appreciate being here.
Yeah. So can you just introduce yourself to our listeners in case they're not familiar with you?
Yeah, so I'm DocJenFit across all platforms, and I'm a doctor of physical therapy. I have 2 babies of my own now, and I feel like I'm still in the thick of postpartum because we're not sleeping that well.
I think it lasts. I feel like I'm still in the thick of postpartum where I get like little chunks of sleep throughout the night. And there's a lot of like begging to my 7-month-old, like, please just go to sleep, please. There's a lot of like attempts at negotiation. She's not complying.
Yeah.
So let's talk about movement during pregnancy, postpartum, and how just important it is. And so one of the like top myths that I hear is you have to maintain perfect posture. One, to support your baby's position, to feel good in your body. It's better for your health. And this obviously expands outside of pregnancy as well. Like I see devices that are like perfect posture, bras or back straps. And so there seems to be a really big emphasis on finding this one static, perfect position. What is your take on that? And what are kind of the nuances with maintaining perfect positions?
Well, I think we first have to identify that there is no one perfect posture and get that out of people's mindset, first of all, because that's just that's unrealistic and false. And what it does, it can create either more anxiety or more stress on the body, because now we're forcing the body into a posture that it's not used to being in. And so imagine trying to pull your shoulders back and hold a certain posture and turn on muscles all throughout the day. Now you're not letting your body relax. You're increasing the tone of the muscles so that you're not going to have as much mobility, as much movement. You're going to create more stress and tension in the body. So I hate the idea of focusing on one perfect posture. I think posture is developed on your own based on how you move your body more often throughout the day. That's the goal, ultimately. Like, we shouldn't be standing in one position all day long. We shouldn't be sitting in one position all day long. You know, the whole point is that we're supposed to introduce our body to so many varieties of movement. And that is ultimately the goal. And I think that's what we miss out on most often.
Absolutely. I remember when I was writing my book, I was researching like what causes like low back pain and kind of the things that increase the prevalence during pregnancy. And a lot of it is not, oh, this person wasn't in perfect posture. It was lack of movement. So if somebody is kind of stuck in a position all the time, it could end up increasing discomfort that they have in their lower back. And I feel that for myself and my own body. Like if I am stuck in one position all the time, like holding my baby, standing in line. Like I'm always kind of arching in my back is usually my postural tendency. Like my low back will start hurting a lot. And then once I add in some mobility and some movement to find some more flexion in my spines, find more rotation, I usually find that the pain relieves itself pretty quickly. Is that something that's familiar in your experience?
Oh, 1,000%. Yeah. And we also have studies where we look at, at neck posture, because I know that's such a huge one right now, especially we're all on our phones. And so we're looking down. And, we actually have research that continues to say it is not the one position that you're looking in that's going to be more likely to cause neck pain. It's actually forcing yourself into a certain position that could cause neck pain more often. So, same with the low back, like you were talking about, same with the neck, it just depends on how we want to move the body altogether. And so, I typically tell people if you're wanting to get out of feeling like your head is coming forward so much or feeling like you're getting a bump in the back of the neck or anything, well, then it depends on what we're doing all throughout the day. And so, are we moving through the upper back a lot more? Are we creating space for the neck to be a little bit more aligned over the body without having to force it into position? Are we working the deep neck flexors while we're doing exercise? Or are we always keeping our head out? Even these chin tuck exercises, they don't have to be done in isolation. It could be done when we're doing a chest press. It could be done when we're doing a lat pull down, a deadlift. Like all of these neck control positions and strengthening and stability around the neck can come when we're doing regular exercise. But we have to understand, how often are we getting to that? How often are we doing it? How often are we focusing on it? And that's why sometimes getting programs where people are cueing you and people are pointing out things that you're probably not going to pay attention to can be so helpful in or not only getting programs, but working with a personal trainer, working with a physical therapist, working with someone who can point things out that cues you into the areas that you might be neglecting. Because once we start to strengthen, open, put ourselves in all these different postures and positions, your body's naturally going to start holding itself in a different place. And you're going to start feeling a little bit more ease, a little less tension, a little less stress. And ultimately, that's what gets us into this better posture position. We shouldn't be forcing it. We want the body to find its way there on its own. And that's why there's also no one perfect posture, because every body is going to find a different position. And I know you guys talk about this a lot too when it comes to pregnancy and having to be upright all the time and having
Oh
to,
gosh.
because that's been a huge thing that I think has been going around, which again, now we're going to create more people having more tension into the low back and trying to force a posture and a position that isn't natural and normal for the body. And we also have to understand, if I'm pulling my shoulder blades down and back, which I hate that cue. But if I'm pulling my shoulder blades down and back, I'm now flaring my rib cage, which is already in a position that's not optimized as we're pregnant. So now I'm just creating probably more tension through the back, creating more stiffness through the body, and more stress, again, anxiety of trying to force yourself into a position that your body's not used to being in all the time. It's just not natural, and it's not ideal for the body to have to be.
Oh my gosh. Yeah. For me, you must maintain this perfect position during pregnancy or else your baby will be in a horrible position. I even saw one like really prominent page that their statement was poor posture is the number one cause of C-sections. And I was like, what did I just read? Like, are you serious? And I know that this causes a lot of anxiety for folks where they're like, I can't even relax on my couch when I'm watching a movie or when I'm watching TV. I feel like I have to always be upright and sitting perfect. My belly button has to be forward or else my baby's going to get OP. Like I posted a video where I was showing like how you can use your pregnancy pillow to find a more reclined position if that feels more comfortable for you when you're sleeping. And there were so many folks that are like, but if I sleep like that, my baby will be OP. And I'm like, oh no, please, please stop. But it's so prevalent that it's really hard to overcome and feel confident to be able to find a relaxed position. And so again, yeah, people are kind of forcing themselves into this perfect posture. I don't know if that was something that was kind of marketed to you or you heard a lot more prevalent like as when you were going for your VBAC at all, because that's something that like I'll hear a lot from our clients that had C-sections for their first and they were wanting a VBAC for their second, was all of this additional pressure to move in the perfect way to like set themselves up for like quote unquote success. Did you feel the same type of pressure?
I did see, some things, and I know they talk about it a little bit in Spinning Babies. So when I went back and listened to Spinning Babies about, especially because he was breech for a little bit, not very long, like I think 32 to 35 weeks, he was breech. So I was, going back to Spinning Babies and trying to do some of the maneuvers, and what I ultimately found um, was just creating more space in my body to allow him to get into the position that he was most ideal for him. And I also had talked to moms where it was like, I couldn't force it. And ultimately he came out, or we had a C-section. He had a really short cord. So he wouldn't have been in an optimized position in order to have flipped. And so it was like, okay, like, hearing that this all gets to work out the way that it does for baby and me and what is best. And all I can do is help to create that space for him to be in that place. But it didn't come from me forcing a posture or having to be in a perfect posture. And so I let a lot of the maneuvers, I let a lot of the things go and just said, okay, if I'm thinking of creating space and relaxing tension, I want to open up my upper back. I want to release some tension around my rib cage. I want to make sure there's mobility and movement along the scar area from my cesarean, around my hips. I want to do some down regulation. I want to do some breath work. I want to allow the baby to do what he needs to do. And it worked. And I think also not stressing about it. And I heard other moms talking about that as well, of like, he ended up in a position and I didn't do, he ended up head down and I did nothing. I did no focus on posture or positioning or anything like that. And I think letting go of stress and making it a certain way is actually what helped. And so I really took that into consideration because we know that the body is it goes through so many positions, through so many postures throughout the day. So feeling and thinking that only one posture and position is going to be best for baby just really didn't make sense to me physiologically. And it's better for the body to be in different postures, to be in different positions, for your body to be able to relax and for your body to be able to reduce tension in all these different ways and all these different planes of motion. So, I saw reels, I saw things going around about being in the perfect position, and I just laughed. And I also felt bad of like, these women are sitting on their couches, on the edge of their couch, because they feel like they cannot relax. They can't watch a show and sit back, and it makes me a little sad to think about. Like, and I think I had it for a slight second of like, oh, I need to do this. And then I was like, you know what? I really don't. I really don't. I could watch the show and lean back and be okay. And I had to be back.
Yeah, it'll be okay. Yeah, we get a lot of folks that are like, if I lounge, my baby will be OP, or my baby is OP. What do I do? Like either maybe their provider told them that their baby was OP, and they're like, oh, which means like the back of baby's spine is to your spine. And it's like, oh, well, you need to try to get your baby into the perfect position of OA or LOA are usually kind of the two that are marketed as like quote unquote best. And I think one of the things that's most important to remember is one, like we're kind of talking about, there's no perfect posture for us just in general. Like our body does not maintain a static position all day. Like we have to walk, we're doing different activities. And so there's so many different positions that we have to be able to move to. And the better we can change position, the better for our comfort and for our function, the less compensation that we're going to have. And so it would only, again, make sense that there's no one perfect posture. And so that one perfect posture is not going to be the only thing that your baby is relying on for their perfect position. And more along the lines of what you're talking about is rather than trying to force baby into one perfect position or to force yourself into one perfect posture, let's focus more on ensuring that their path to rotate is clear. Their ability to change positions is easy for them to do. And so with a lot of like the workouts that we do, it's never this workout's going to force your baby to be in a perfect position. This workout is going to help to release the tension to make it easier for your baby to rotate when labor does begin, for you to be able to move your body more easily when labor begins. Because again, there's no one perfect position that opens your entire pelvis. There's a lot of different movements that we have to move through to create space in different parts of our pelvis to change tension within our pelvic floor. And so, yeah, it wouldn't make any sense that there's only one perfect posture, and this one perfect posture is the only thing that is determining your baby's perfect position. And I think when we recognize that we can actually just relax and to let go, and that would probably do more for you than holding one specific posture where you're stressed and tensed up, because that is probably going to create some pelvic floor tension. Is probably going to be better for you to just relax and to lounge on your couch. Like I'm totally on board with that. What are kind of like I know that you do a lot of like mobility challenges and you offer like tons of mobility and like strength work within your app. What is kind of like your walkthrough of like overall mobility that you're thinking of when you think of like full body? If somebody was going to watch this video or they were going to listen and they're like, okay, for my neck, I want to think about these type of movements. For my spine, I want to incorporate these type of movements. Like what would your kind of general like full body flow kind of include?
So I like to go back to oh my gosh, I'm blanking right now on who this method is. It might come to me. But there's a joint by joint method. Very simple, very easy to kind of generalize the body in this way. Now, obviously, the body doesn't just move in this way, but it's an easy way to be able to think of one joint is going to have, we're going to want one more mobility in one joint. We're going to want more stability. Mobility, stability, mobility, stability. And when we think of the body in this way, it helps to understand a little bit more of like, oh, my neck should have a bit more stability, my upper back a bit more mobility, my low back a bit more stability, my hips more mobility, my knees more stability, more mobility along my ankles, and more stability around my feet, more mobility around my big toes. Now, obviously, again, we want mobility and stability throughout the entire system. But this is a really easy way to be able to say, okay, if my low back is feeling a lot of tension right now, have I been working on the mobility above and below? Have I been opening up my upper back? Have I been opening up my hips more? My neck is feeling really tense and really tight. Rather than just stretching my neck because it's likely already in a stretched position, what if I started to address my upper back a bit more? What if I started to address how my shoulder blades are moving and the stability and mobility around my shoulder blades and around my upper back so that I can help take tension off of my neck? So I think when we start to just pull back for a second, especially if we're having a lot of pain and tension in different areas, stop focusing on that area. Let's pull back for a moment and look at the areas above and below and how those might be affecting what's happening into that certain area. Or say the upper back is feeling a lot of tension, well, have I been working on my stability around my neck, on my core stability below? So this is where, and again, it's a general thing. It's not going to work for everyone, but it's a really easy way to say the body likes homeostasis, which it does. And so if I want to find better balance, where am I not finding mobility? Where am I not finding stability? And again, the neck, stability, upper back, mobility, low back, stability, hips, mobility. So if we, again, look in that certain pattern, where can I start to optimize mobility and where can I start to optimize stability? It's a really simple method to kind of use. And then I also like to say I don't like to add a ton of time to people's life because I understand. That's why on Gen Health, I'm always like, the plans take 5 to 15 minutes because I want you to do your thing. Like, go do your workouts. Like, you guys like the MamasteFit things? Great. Go do it. This is just an additional little add-in of things that you could potentially be missing out on. Could potentially, if you went to a physical therapist, here's what they'd likely be giving you for your low back or for your knee or for your neck. Things that you might not be thinking about. So that's what I try to sprinkle in, whether it's a little thing you're going to do in the morning, a little thing before your workout, a little thing after your workout or before bed. Like, I'm all about sprinkling in those little things rather than worrying about doing an hour-long mobility routine that I now have to take on along with my strengthening and my other things that my walking I'm supposed to get in. Now I'm supposed to get in some HIIT interval training and I'm supposed to, all these things that we're supposed to get on. It could be really overwhelming. So my thing is always like, where could I be lacking mobility or stability and where can I start to sprinkle it in?
Yeah, I love that. Yeah, there's so many things on like the pregnancy to-do list to prepare for birth, to have a good experience. And so it can totally be incredibly overwhelming. It's like, oh my God, now I have to do an hour-long mobility too? Like, geez. And so I think there is a balance between the mobility, which I think is different than just straight up stretching, but the difference between like mobility, kind of the stretching aspect, improving joint range of motion, and like the strengthening, like the resistance training, because kind of like you were saying, our joints are stable, mobile, and kind of down, up and down the body. And so if we have too much mobility, can we add on some strengthening to help support it? If we have too much stiffness, can we add on mobility? So also being able to understand, okay, if I have too much movement happening here or too little movement happening here, maybe I can add in mobility or more strengthening. Because I think it is like a pairing of the two. When I think of like pelvic stability to start, because that's where like a lot of us have issues during pregnancy. I think you might have had some pelvic pain. I have some during my pregnancies as well. And one of the big things that can contribute towards pelvic pain is one, the pelvic position. How well do the pelvic pieces kind of fit together? And how stable are they in that position? And some of that is maybe one muscle a little bit tighter on one side than the other. And so it's kind of pulling the pelvis into a position that it can't quite get out of. And so in those instances, mobility can be really helpful to release the uneven tension so that the other side, now we can strengthen to help pull that pelvis kind of where it needs to be to help stabilize. And so that would be like one example of mobility versus strengthening. And so specifically for most of us, we have a little bit of left pelvic half sits a little bit more forward, right half sits a little bit more back. And so if I was having some SI joint pain, for example, I can think, okay, my right inner thigh is probably a little bit tighter than my left. Let me mobilize and stretch that. But now I need my left pelvic half to be able to pull back. So I'm thinking hamstring adductor strengthening. Right side, I'm thinking glute quad strengthening to help pull the pelvis to a neutral position or the opposite position. So that would be like kind of one approach that I would do specific to how can I combine mobility with strengthening. And it sounds like that could apply just kind of up and down the spine. If someone's having upper back pain, well, can we add maybe some more mobility to the chest? Can we add some more strengthening to the low back, to the core to help stabilize in that area? Do you have any other examples of like kind of common areas that you see folks having issues with?
Yeah, I mean, there's so many areas of the body that people can, get hung up on. And I think what's important to know also is that and this was a little hard for me as well during pregnancy, is hearing pelvic symmetry. And the pelvis has to be in this perfect symmetrical position in order for baby to move through and deliver. And I'm like, well, that's why we have hormones that create laxity around the pelvis so that the pelvis can move out of the way as baby is moving and do its job. So I think our goal is to find as much, where are we restricted, where are we tighter, where are we, not moving into. I think that is ultimately the goal of our body, just to be able to find more ability to move and ability to access different positions. But I always get really hesitant on the pelvis has to be in this perfect alignment, in this perfect posture, in this perfect symmetry, because the reality is we're not perfect symmetrical beings. Like, I can even look at my face and, my hairline comes back more on one side than the other, or my nose is one way or the other. And then I go down the chain and I continue to find asymmetries. And the reality is we look inside and we have complete asymmetries throughout the body. We have our we have different lobes of the lungs. We have our liver that's huge and it's on one side of our body. And then we have, so we have all these asymmetries inside. We're going to and we write with one hand, we kick with one leg. We're going to have asymmetries on the outside as well. So I love that, you kind of direct us to like, okay, where could you be tighter? Where could you be a little bit stiffer or need to move into as much? And I like to remind people we're never going to find the perfect posture. And that's why it's hard for me. Even I go to professionals. I go to chiropractors. I go to physical therapists myself. And when they say, oh, one hip is higher than the other, I'm like, yeah.
It's supposed to be.
Yeah, that's my body. I also have scoliosis. So if I'm going to have, some lateral curvature of my spine and it's going to end up in one way, my pelvis is probably going to always be off no matter what I do. But I have no back pain, I have no hip pain, I have no SI pain. So we can't also say one leads to the other. And we have studies now where we look at where anterior pelvic tilt is one of the most demonized positions of the pelvis, right? I want to get out of my anterior pelvic tilt. First of all, it's not a diagnosis and it's not a bad thing. It just might be where your body is holding more positioning. So again, how could we find different positions of that pelvis? But in a study of asymptomatic people, so like people who have no pain at all, we're finding that like I think it was like 87% they measured had anterior pelvic tilts, about 9% had posterior pelvic tilt, 7% were completely neutral. And again, you're going to have differences, physical therapist or clinician to clinician, whoever is measuring it. It's always going to be a little different. There's no clinician to clinician consistency, unfortunately. And so again, this isn't a proper diagnosis. Your body moves in all different ways. We have asymmetries throughout the body. So again, it's just finding, okay, are my hamstrings are not taking on as much pressure with my glutes? Maybe my quads are really tight and I need to reduce some of the tension over my quads. Adductors tend to be a really tight place for a lot of women. So getting into some positions that open up, stretch, and strengthen the inner thighs, places that stretch and strengthen the lats. Those are areas that can create some tension down into the back or reduce movement along the spine. So sometimes getting into more side bending positions, getting the body into using our lateral strength. So getting into side planks, getting into things that move us into rotation. Those are areas that I think can be really neglected and sometimes we need to kind of address. But I just want to put in people's heads, like if someone's telling you your pelvis is out of alignment, that's okay. Like rather than telling me I'm out of alignment, tell me where I'm a little tight. Tell me where I can fire muscles a little bit more. Tell me where I'm neglecting positions or I'm not finding a range of motion in a certain way. But to tell me that my structure looks a certain way doesn't tell me anything, because we know now that there's people who have all the pain and no problems in their pelvis, and then there's people who have all the pelvic asymmetries and everything going on in their body and they have no pain at all. And it was also interesting, I just want to tell, like from first birth to second birth, I felt like in my first pregnancy, I did all the things. I worked out probably even more than I did in my second one. I really addressed so many different ranges of motion, so much mobility work, pelvic floor, perineum, stretching, all the things. And I did not get past 5 centimeters. I also didn't feel a lot of pelvic pains. I felt no pelvic pain. I felt no pelvic symptoms. I felt no round ligament symptoms. I felt no clicking and movement in my pelvis. I felt nothing. And I also did not open for whatever reason, whatever that may be. Second pregnancy, I felt pelvic symptoms from like second trimester on. They would come and go. They were managed with movement and what I was doing, but I felt I would do hip 90-90 and get so much clicking in my pelvis. I would just move different and get and feel the movement in my pelvis. And then I had a baby who was 2 pounds heavier with a VBAC. So it's interesting to me to also that's where I feel like the hormonal changes, the laxity changes in the ligaments play such a huge role rather than I mean, and who knows, because I did all the mobility work, I did all the strengthening work, I did all the things, and I had 2 completely different outcomes. So it's very interesting to observe.
Let's take a break from this week's episode to hear about our podcast sponsor, Needed. Needed is a perinatal nutrition company that specializes in optimizing nourishment for the perinatal timeframe that both Roxanne and I and Jen use to help support our pregnancies and our postpartums now. One of Needed's products is a prenatal vitamin, and they have a few different options because similar to how there's no one perfect posture, there's also no one perfect supplement to take. And so Needed offers their prenatal vitamins in 3 different options. They have their powdered version, which was something that I utilized in the first trimester when taking pills was just not going to happen. I would throw the powder into a smoothie, and that's how I would get my prenatal vitamins in. And then as I moved into the second and third trimester, I was using their capsules. With their capsules, they have 2 versions of that. They have their multivitamin and they have their essentials. The essentials is fewer capsules than the full version, but a little bit less nutrients. So they kind of give you the most bang for your buck with the smaller capsule size. And even now into the postpartum, I'm still taking Needed's prenatal vitamin. And what's really great about Needed is they're doing actual research studies on their prenatal vitamins to determine how well they work. And what they found was women that were taking their prenatal vitamins had higher levels of several key nutrients in comparison to other prenatal vitamins on the market. And so you can trust that Needed's prenatal vitamins are not only high quality because they're third-party tested, but they're also going to help to nourish you more effectively throughout your pregnancy and after birth. And remember that Roxanne and I only recommend brands that we personally use and trust, and so you can know that Needed is one of our top recommendations. You can check them out at thisisneeded.com and use code MamastePod to get 20% off your order. Yeah, I definitely feel that when we put less pressure on ourselves, our birth experiences can be really different too. And that's not to say if you do these, if you totally relax in your pregnancy and you hit these 4 markers, you'll have the perfect birth. But even for me, with each birth, I felt during each pregnancy, I was kind of releasing a little bit more of my expectations of myself. Each one I still exercised and I was still moving and kind of struggled with SI joint pain and all of them. But my expectations or my ability to let go of expectations and ego increased with each pregnancy. And each labor was much easier because I think when I let go of my ego, it allowed my body to just kind of release into it as well and to open and to do all the things it needs to do during labor. So I could see that there is some correlation between letting go of the expectation. Maybe there's more of muscle memory of opening and increasing movement that's happening. And just overall, just the down regulation that I think comes with releasing to the experience, I think plays a huge role. And I see that with my VBAC clients too, the ones that can really just surrender to it, or even with my clients that haven't had a C-section before, the ones that can really just surrender to, hey, I have a plan. I feel prepared. I'm setting up the conditions for the experience that I'm wanting, but I'm really just going to surrender to whatever needs to happen. And I find that things just go a little bit smoother for them compared to the ones who come into their labors with a lot of anxiety of, I hit my checklist. Oh, I did it. I was sitting in a slouch position that one time. And so I think letting go of that ego and surrendering is huge when it comes to our labor experiences. And totally on board with, it's not perfect pelvic position or perfect posture. It's about how well can you change positions? How well can you move? And I think most people favor an anterior pelvic tilt just in general. We walk forward, our pelvis is going to tilt in the direction that we're going to be moving. And so it would totally make sense that most of us favor that position, especially during pregnancy. And just because we favor certain postures during pregnancy or even outside of pregnancy doesn't demonize them. It doesn't equal having more laxity in our pelvis doesn't equal pelvic pain. Having a certain posture doesn't equal this dysfunction or this issue. It's how well can we then move out of said posture? How well can we change positions with control, with ease, like you're talking about, as opposed to forcing ourselves into a different position? And I think that definitely contributes towards a more comfortable pregnancy experience. And then also just kind of releases a lot of that stress. Like I think that plays a huge role in our comfort during our pregnancies for sure. So let's talk about kind of what you felt was the difference between like your first pregnancy and birth versus your second. Because I know that we have a lot of listeners that maybe didn't have the experience that they were hoping for with their first. Like they did all the prep and it wasn't the experience that they thought they would be, whether they had a vaginal birth where maybe they got an epidural where they were wanting to go unmedicated, or maybe they had a C-section when they were hoping for a quote unquote natural birth. And now they're preparing for their next birth. And I see kind of like two types of people generally. One has like a really long list of these are all the things I'm going to do to have a better experience this time because these are all the things that I failed at my first time. This is why I had that bad experience. So I'm going to go against that. And then we have somebody else who is just kind of like, you know what? I really just had no control over that, and I'm going to prepare as best I can, but I'm just going to kind of let it go and just surrender to it. How did you kind of navigate the two, and what would your recommendation be for someone who's feeling like on the more guilt side of things?
I think that's where we'd first have to, like, I feel like pregnancy itself is your first introduction into motherhood of like, you can't control the outcome because you can't control whether you get to see baby at the end or, like you can't control anything. And I think, you having been through miscarriage as well as me, you get to really see that right off the bat. And then you go into birth and you're reminded again, like, oh, I really don't have control. Like I could do all the prep work I could do, but I have no control in the outcome. And I think that is how I thought I went into the first birth, is like not having expectations. Obviously, I had what I hoped, but I think that also did help to be able to advocate for myself along the way of like, okay, if we're going down this path, what is it that I really want? I'm going to choose. And like, I remember, ultimately I started with a home birth. We ended up going to the hospital, and one of the OBs was like, told the nurse that I was going to have a cesarean before she even came and talked to me. And I was like, felt really icky about that. So I was able to advocate for his, okay, who else is an OB here? Like, who else is on call? I want to have another person. And so I feel like I got to advocate for myself, even though I ended up in a cesarean, which was not where I wanted to be. Obviously, I was trying to go for home birth. And so second time, it was like, okay, releasing those expectations again, but also being so committed to what I wanted. So that was hard. I feel like that's a hard thing to do, where it was like mentally I had to full on say, I am going to VBAC. Like I know this is possible. I know my body can do this, and I'm going for the VBAC. And at the same time, I'm okay if things adjust and go a different way. I'm letting go of the outcome, but my intention moving in is to get that VBAC. Because when I first got pregnant again, I was like, oh, maybe I'll VBAC, maybe I'll have a cesarean. I don't really know. We'll see. And I kind of left it really airy, floppy in the air. And I talked to the OB, actually. I was seeing midwives throughout the practice. And then when it came time to sign off that I was going to get a VBAC, I talked to the OB. And he just very plainly said, your VBAC will happen if you believe it will happen. Like, you can definitely VBAC. You have to believe that you can VBAC. And that sunk in with me so much of like, okay, I get to really choose. Because even when he was leaving, I was like, well, if I need to go into the cesarean, would you do my cesarean? Like, I was still kind of like, well, what if this happens? I had to full on believe that it was possible. And so I think the mental aspect is such a huge role in pregnancy and birth. And it's hard because you go in with the ability to know that this is possible. And you also have to go in with releasing any expectation of what the outcome may be. And I think that's helped in not having traumatic births with both birth experiences. feeling empowered, feeling acknowledged, feeling like, okay, this isn't where I want to be, but here we are, and what can I do, and how can I help it? Like I ended up pushing on my back, holding my breath, legs open wide, in a position I never thought I would be in for my VBAC. But here we were. And so it was like, okay, what can I do in this moment to make it the best experience for myself possible? So I think we go in with the intention full-heartedly was my biggest thing in the VBAC, knowing that uterine ruptures can happen, knowing that I might still have a cesarean at the end of the day, knowing that I might not dilate all the way, and that's okay. I remember when I got to 6 centimeters, because I only got to 5 centimeters in my first birth. So when I heard 6 centimeters in my mind and body, I was already successful because I had already gotten further than I got last time. So no matter what happens after this, at least I know my body was able to go further. And that was pretty cool to me. For my husband, he was like, oh, that's still only 6 centimeters. It was such a huge accomplishment. So I think just really getting mentally prepared as to having that intention and releasing the expectation, that was huge. That was the biggest for me. And then, I think we could do all the things, but we just, like we've been talking about this whole podcast, we put our body in the best position possible by opening as much as we can, by strengthening as much as we can, by finding new ranges of motion so that our body can naturally find that on its own as needed in birth, as much available. But, I went to chiropractic a couple times. I didn't feel like it was as personalized to my structure. It was the same kind of technique every single time. So I ended up going more to a pelvic floor therapist that was a little bit more specific based on my restrictions or and gave me homework based on what they found. So for me, that felt better to be like, okay, here's what's not moving as well. Here's what I could be doing. But I think you get to find what that is for you, whether that is chiropractic, acupuncture, physical therapy. But I think getting other people to be able to see, okay, here's where you are, here's where you can be, and here's how you can help yourself get there as well, which is why I love your guys' programs as well, because you give the tools to allow someone to step into their own body and discover and learn. And I think that's most important when you're preparing your body, is having control as to what you can control, not what someone else is controlling, not what someone else is opening, knowing that there's no perfect alignment. Other people are helping to facilitate what we could be missing in an area. And that is the only thing I could do for the VBAC leading into it, was like, where could I be missing? Where could I be opening? One very interesting thing I'll end with is I did see a pelvic floor therapist who did really, really, really deep ligament release work, which I don't think is as common. So you might not find a pelvic floor physical therapist who do this, but it's basically going internal beyond the muscles and then pushing into the ligaments and holding sustained pressure until you feel a release. And I did feel a release. It was very, very interesting. Did that help with my VBAC? Probably not, but mentally I was doing anything I could to create in the pelvis.
Oh, man, that's really interesting. I had a little bit of pelvic floor release at the end of my most recent pregnancy as well. We have 2 pelvic floor PTs that work out of our gym. And so we did a little bit of internal work. So for any of our listeners, if you are like wanting to do internal work, sometimes PTs want you to have some sort of clearance from your OB. Sometimes they don't, usually as long as you don't have any sort of like complication where like you can't penetrate the vagina, it's usually not an issue. But so just be aware that some PTs may or may not want to do internal work with you while you're pregnant, but you can totally work with a PT during pregnancy. So she did internal work on me, like more to like, I think my right side. And it was like that sustained pressure. And I was like sweating a little bit. I was like, oh, this is intense, but it felt so much better, especially after the fact. And I totally think like my baby like just dropped a little bit more. And I actually went a little bit earlier than all of my other pregnancies with this one. Maybe it helped. I don't know. We'll see. Or I guess we won't see. We'll just question it.
Yeah.
But I also found that of the two, if I had to only pick one modality, like PT, I felt was more like individualized, especially with that like internal assessment and kind of like the overall viewpoint of like the body. And I know that there are chiropractors that are they kind of teeter on that line of like PT and chiro, but I definitely find that if they're not like getting up and assessing you and they're not like monitoring how you move, like you might be missing like a really key piece. Because again, it's not just what is the alignment of your pelvis and your spine. It's like, well, how does it move? And how well do you change positions as opposed to like, what are you just laying on my table? I might be dismissing what a chiropractor fine tunes. We're going to have one come on the podcast that lives here locally. But it's like, what kind of like assessment are we doing to identify that this joint moves well and it's a controlled movement versus like, this is your alignment right now. But well, thank you, Jen, for coming on the podcast and sharing your personal story about the difference between your two pregnancies and all about how there is no one perfect posture. We can all let that go. If you're following a social media page that's making you feel like garbage after you watch a reel, maybe unfollow for a little bit. I hope it's none of our reels or any of Jen's. But if folks want to learn more from you, where can they find you?
I'm DocJenFit on all the places, Instagram, YouTube, TikTok. And I also have a Gen Health platform. So it's just gen.health. Literally, you can use it for free. If you sign up, there's a discover section that has a search bar and you type in anything and it's essentially my Instagram searchable. So imagine not having to scroll anymore. You could just type in low back pain, knee, hip mobility, whatever it is, you could type it in and you will find a video for free. So you can explore it completely free. We also have different plans that take you through that kind of track progress daily so that you can really start to just sprinkle in the things that you could be neglecting. And I think that's the biggest thing. I queue like crazy in my app because I don't want it to just be a thing where you're coming and you're moving, but you're learning. And so whoever is a part of Gen Health for however long they want to be a part of it, my goal and my purpose of doing it is that you learn something about your body so that once you step away, no matter what you're doing after this, you either know what you need to do to help yourself through a certain pain area, or you know how to modify when you're in a different class. So that's my goal.
I absolutely love that. I think there's something really special about being able to take information that you're learning from somebody and then apply it to you as an individual. Because like you're not going to be there to cue somebody through every deadlift rep that they do. Like I'm not going to be there to coach someone through every labor position that they do. And so being able to take the information in a digestible way to then apply it to you as an individual is invaluable. So thank you so much, Jen, for coming on the podcast. For our listeners, head to the show notes. We're going to link all of Jen's platforms down there so you can find her easily. Definitely give her a follow on Instagram. I've been following her for years, I think since the beginning of MamasteFit. So, and really excited to have you on the podcast.
Yeah, thank you for having me.
Thanks so much for listening to this episode with Dr. Jen. If you want to move more confidently throughout your pregnancy, because again, there is no one perfect posture, there is no one perfect position for your baby, and there's no one perfect labor position, we go over all the nuance of that in our prenatal fitness course and in our childbirth education course. With our prenatal fitness course, we're going to help you to move your body more confidently throughout your pregnancy through a variety of different positions that are important, one, for your prenatal comfort, but also to create space in your pelvis and to support your baby's position for birth. Because again, there's no one perfect position. There's a large variety of movements that we should be incorporating throughout our day, throughout our workouts. And we do that for you in our prenatal fitness program. And then in our childbirth education course, we talk more in depth on the nuances of baby's positions, different labor positions, to help you better understand what might be the best choice for you in your individual birth experience. You can check out both our prenatal fitness program and our childbirth education course on our website at MamasteFit.com. And you can use code STORY10 to get 10% off any of our online offerings. And you can bundle them together to save an additional 15% off at MamasteFit.com/bundles. This podcast is sponsored by Needed. Needed is a perinatal nutrition company that specializes in optimizing nourishment for the perinatal timeframe. You can check them out at thisisneeded.com and use code MamastePod to get 20% off your order.